For this section on the respiratory system, we're going to look at ventilation, which is breathing, how we move air in and out of our lungs. Ventilation is dependent on a set of skeletal muscles, therefore voluntary muscles, which expand the thoracic cavity and, in relaxing, allow it to contract back to its original size. To just say that the thoracic cavity expands and we breathe is oversimplistic. We're jumping over several steps. It's really about the interplay of pressure and volume and the different pressures found in different parts of the system. So to begin with, the inter-alveolar pressure is the pressure inside the lungs, down in the alveoli. It'll be continuous with the pressure of the air in the bronchioles and the bronchi and the trachea and the rest of the respiratory tract. It's generally going to be the same as the pressure inside. It's generally going to be the same as the pressure outside, except when we're in the active process of breathing. So it actually changes a little bit through breathing. As its pressure drops, air rushes in from outside. As its air pressure rises, air is forced out of the lungs. The lungs expand when the thoracic cavity expands because of the action of the pleura. Now, there's a pressure in the pleura called the intrapleural pressure, which is roughly always about 4 millimeters of mercury less than the interalveolar pressure. And the transpulmonary pressure, that difference between the two, that 4 millimeters of mercury, is important in what keeps the lungs sort of stuck to the inside of the rib cage. When we breathe in, it's actually because the volume of the lungs have expanded just a little bit and the interalveolar pressure drops, maybe only by a couple of millimeters of mercury worth of pressure. That little bit of pressure change is enough to move air from the atmosphere into our lungs. And then when the thoracic cavity compresses, the pressure will go up a couple of millimeters above 760, and that difference in pressure is enough to push the air out of the lungs. Simple breathing is really dependent on just two muscles. The diaphragm, which is the floor of the thoracic cavity, when it's relaxed, is bowed upward into that floor. And so when it contracts, it flattens out. And then flattening out drops the floor of the thoracic cavity down. Also, there's a whole series of muscles called the external intercostals, which attach the ribs together. And they're the externalmost of the muscles of the rib cage. When they contract, they basically pull each rib up towards the one superior to it, acting like an accordion to sort of lift all of the ribs up in incremental amounts. Those two movements together will expand the rib cage enough to increase the lung volume so that pressure drops a little bit and air rushes in. That's inspiration, inhaling air. When those two muscle types relax, no other muscle has to contract. Those muscles relax. The diaphragm goes back up into its relaxed position and the rib cage relaxes down into a lower position. There is elastic tissue in the lungs which helps to sort of recoil, pull everything back to its resting position. Therefore, the volume of the lungs goes down, the pressure in there goes up, and air gets forced out. That's all that's required for basic breathing. If we're going to take a deep breath or force air out across our vocal cords or something like that, we're going to use other muscles to do that. The three images here are from the muscle system chapter in the book. You can go look online at them there or zoom in on them in this presentation. I wanted to list out the muscles involved in breathing. Now, for just basic regular breathing, the diaphragm and the external intercostals are all that are needed. For a deep inhalation, the sternocleidomastoid, pictured in the neck muscles picture above, will lift the rib cage up towards the chin. The scalenes, which aren't in any of these pictures, will lift some of the upper ribs higher. And then the pectoralis minor, which is in the thoracic arm picture above, will lift some of the middle ribs up. For expiration, the abdominals, all of them, which are in the obviously abdominal picture above, and the internal intercostals will force exhalation, such as for speech. This figure describes the volumes and capacities of the lungs as suggested by data from a recording spirometer. Now, the numbers that we're looking at here are based on averages for men. The numbers for women would be different, but these are nice round numbers for men. Now, just normal breathing in and out happens really sort of in the middle of the graph in the yellow bar called tidal volume, and roughly 500 milliliters of air moves in and out with every breath. It's called tidal volume because it's sort of like waves lapping up on the beach. If you're breathing along normally and then just clear all of the air out of your lungs that you can, so you can't exhale anymore, you're using up the expiratory reserve volume. Now, if you clear out your lungs of all the air that you can, you're not going to actually empty your lungs completely. That's because you can't have a vacuum in your lungs. You have to have some air there so that they don't collapse in on themselves completely, and that's called the residual volume. Most people don't tend to use the expiratory reserve volume, and so the two volumes together, expiratory reserve volume and residual volume, are the functional residual capacity. It's how much air you have in your lungs at any given time, sort of beneath what you're breathing. Now, air is mixing in and out all the time while you're doing this, so it's not that some air is stuck in your lungs all the time. There's always a mixture going on there. If you then, from regular tidal volume breathing, inhale all the air that you can and fill your lungs completely, that's the inspiratory reserve volume. Because you're breathing in at tidal volume and you can breathe in all of the extra air there in the inspiratory reserve volume, together that's the inspiratory capacity. Now, inspiratory reserve volume, tidal volume, and expiratory reserve volume together equal vital capacity. All of the air that you can move in and out of your lungs. And then obviously the vital capacity and the residual volume together make up the total lung capacity. Consider this question. When you feel that you've reached an answer, hit the next button to go into the next slide, which will reveal the correct answer. The sternocleidomastoids are responsible for deep inhalations of the list here. They're attached to the sternum and the clavicles, which are right across the top of the rib cage, and to the mastoid processes of the temporal bones. And so when they contract, they basically lift the sternum and the clavicles up towards the underside of the head, lifting up the rib cage and therefore expanding the ribs even further, taking a deeper breath.